quite deep, 2.5 inch deep and close to the spinal cord. Is a recovery possible, a recovery such as this, wherein you see the actor walking out, he's all fine, he's all by himself, he's feeling great, within 5 days, 4-5 days? Because that doesn't seem to go down well with too many.
I think we should think in reference to the patient point of view. He has 6 step wounds, one in left hand that was near where lots of blood vessels and nerves lies. It can cause permanent paralysis of the hand. It can cause blood leakage that can lead into shock and death also. He has a right side neck injury step wound also, that there here carotid artery lies. In nerves also there are lots of there. If it damages the carotid artery, it can lead to sudden collapse and death also. He has 2 step wounds in the back and one is near to the spinal cord, thoracic spinal cord. If that could be cut, अगर वो cut हो जाती है तो वहाँ पे he could have paralysis of the lower limbs, bladder retention, bowel retention, means he will not be able to urinate or he will not be able to defecate also. These are serious injuries. We all are controlled by our central nervous system that consists of brain and spinal cord. These are part of central nervous system. If that there is a cut injury and that damages the dura mater, that is a part of spinal cord, and there is a spinal cord leak. Spinal cord, the fluid that provides nutrients to the brain, from which it works actually. If there is a bigger leakage or he doesn't go on time to the hospital, went on the time to the hospital, it can lead to serious concerns also. Definitely because of good medical infrastructure, in immediate emergency treatment, immediate transfer to the hospital, he could survive also and he didn't have lots of complications. But definitely it doesn't mean that he didn't have a serious or grievous injury. He has serious or grievous injury, they can lead to death also. So I think
but the kind of recovery that he's made, sir, the fact that Dr. Gupta, the fact that he was able to walk by himself, the fact that he looked largely fine, do you think that's possible with given modern medicine and the kind of treatment that you're talking about? It's possible that he comes out of this within 4-5 days? Just to put this to rest, because there's so much speculation going on and we're just trying to counter it with facts.
It's definitely possible because he didn't have any type of shock, any type of serious complication, any type of blood leakage or low blood pressure or neural cut injury. There was partial damage to the dura mater from where there was leakage of spinal fluid. It means he was not, if he didn't receive on time treatment, if the leakage was not closed, then it can lead to the serious injury. Definitely because the surgeries are very fine. There was not severe cut injury was not there, and after the treatment, the removal of the knife from that spinal cord or like thoracic spine, he was recovered very well because his age is good. He don't have comorbidity also. Yeah, and his immunity for recovering is also fast. So that is also justified. We have best antibiotics to give that can be given to him. Steroid have been given to him. There are medical treatment available, surgical treatment available that can provide immediate or even not immediate.
So,
but
despite having suffered or sustained those kind of serious injuries, undergone a 6-hour surgery, he is very well capable of recovering fully, so that he can walk by himself and can be seen the way he is in these visuals after 4 to 5 days. It's absolutely normal, so that puts this to rest for sure. But Mr. Vishwas Pathak, that also answers the concerns that have been raised by certain Mahayuti leaders, that this was not staged. Anybody who suffers this kind of a serious injury is stabbed close to his spinal cord, undergoes a 6-hour surgery, is very well capable of recovering, also perhaps owing to his physical fitness. Kind of political reactions that are coming in, not to take away from the intensity of the probe. So we're tracking that very closely here on CNN News 18. That's all the time we have, gentlemen. Thank you so much for joining us. Thanking Chitra as well. We head into a very short break with that. On the other side, we shift